So still on the topic of botanical. So botanical is also used for non-obstructive GI hypomotility. So if your gastrointestinal tract is not really, there is less peristalsis happening, it's not moving that much. So, and there is no obstruction causing that. Okay, so you can also try botanical. Okay, because you know that botanical is a drug that stimulates the parasympathetic action. It's a parasympathomimetic. So when you have a parasympathomimetic, it's gonna stimulate rest and digest. Okay, so rest and digest. So gastrointestinal tract that is not moving. So the rest and digest will stimulate it to move, to digest. And so this is just something to help you remember that this is like not moving. So remember that the muscarinic agonists actually they help things to move. Okay, for example, in the eye, it promotes the aqueous flow. Okay, so that you don't have increased intraocular pressure. So with drugs like pilocarpine and carbachol, you increase the flow. And then with pilocarpine, it's also used for dry mouth, so stimulate the salivation, stimulate the flow of your saliva, so you don't have dry mouth. And then also we have botanical, which is used for when your urine is not moving because of the contraction of your trigone in your bladder. So it stimulates the detrusor muscle so that it will flow. Okay, urine will flow. So what else will flow? And another one is not about flow that much, but it's about the motility, the movement of the gastrointestinal tract. So this is botanical, which is used for urinary retention and reduced gastrointestinal motility, reduced gastrointestinal movement due to non-obstructive causes. Okay, when there is no obstruction. So what are the adverse effects of cholinergic agonist? So remember the general mnemonic is called dumbbell. Okay, dumbbells or dumbbell. So dumbbells, T is for diarrhea, U is for urination, M is for meiosis. Okay, meiosis, your pupil, and then you have bradycardia. So bradycardia and bronchoria, so secretion in your bronchus. And then you have your heart rate going down, bradycardia. Emesis, you vomit. Lacrimation, you cry, and salivation. You have salivation here coming out, and then you have also sweating. So these are the mnemonic. This is the mnemonic, the main mnemonic for remembering the unwanted effects of, or you could say the adverse effects, but sometimes it's a wanted effect. Okay, depends on the indication and the reason why you're using the drug. So excess acetylcholine, initially it's going to excite the target muscle, the target organ, and then it paralyzes the neurotransmission at the motor end plate, and that's going to stimulate the nicotinic and muscarinic sites. Okay, so nicotinic in the preganglionic, and the muscarinic at the postganglionic sites for the generally parasympathetic system. and it develops usually 12 to 24 hours after the ingestion of the drug. So we have diarrhea, urination, meiosis. Oh, sorry, this is lacrimation, and then we have muscle weakness. So what are the nicotinic effects that we can see? Muscle cramps. So this is not you know that this is some are parasympathetic. Sorry, some are sympathetic, some are parasympathetic. For example, tachycardia is of course sympathetic because of the effect on the ganglion. Okay, nicotinic effects on the ganglion when you have excess acetylcholine, it's going to affect not only um, the the target organ, but it's also going to affect the ganglion, and this is why you have um, the nicotinic receptors. So you have weakness of muscle, you have hypertension because of the nicotinic effects, okay, on the ganglion, fasciculations of the muscle, high sugars, and on the central nervous system, we see anxiety and insomnia. You might get respiratory depression, convulsions, and also coma. Additional effects include acute pancreatitis, okay, inflammation of your pancreas, which is an important enzyme that releases amylase, okay, that helps in your digestion, and also it might cause prolonged QTC on the ECG. Okay, so we know that for the ECG you have the PQRS, KT, and so when you look at an ECG, an electrocardiogram, so one of the things that we always look at when we assess a drug is for the QTC. Okay, we assess a drug during the clinical trial, during the investigation of a drug. We look at the QTC and see whether there is increase in the QTC reading. So this is just an additional effect, okay, of excessive acetylcholine. So for organophosphate poisoning, so you remember the mnemonic salivation. So we'll see the effects of cholinergic agonist. You have salivation, lacrimation, urination, diarrhea, GI upset, and also emesis, vomiting. Okay, and also again dumbbells. So D sometimes can mean diaphoresis, okay, sweating. Also for diarrhea, urination again, meiosis. Okay, your pupil on your eye becomes constricted, becomes small, bradycardia, bronchospasm, bronchoria. Okay, your bronchus becomes spasm, so becomes spasmed, and it's not going to be useful. It's going to be problematic in patients with asthma and also bronchoria. And then you have emesis, vomiting, and then you have lacrimation, excessive crying, and also salivation. So these are the effects that you're going to see with organophosphate poisoning, which we believe is the reason why the guy shown on our first slide, why he was murdered. Okay, how did he get killed? So the cause of death is most probably due to organophosphate poisoning. Okay, so These agonists are contraindicated in asthma because we have seen that it might cause bronchoria, bronchospasm. Okay, and then it's also contraindicated in hyperthyroidism. Okay, you have excessive thyroid hormones in your system that's produced by your thyroid gland. And the reason for this is because the the body reacts to low blood pressure by releasing norepinephrine. Because the muscarine can also induce hypotension, can cause low blood pressure. And this low blood pressure will cause your body to release norepinephrine. And hypothyroid patients are sensitive to norepinephrine and can develop atrial fibrillation. So atrial fibrillation is a condition of the heart where the atrium part of the heart, it fibrillates. Okay, it moves very in a manner that is not normal. Okay, so that's gonna cause problems, and you don't want this condition to happen when you give a drug. So problems in hypothyroidism, patients with hypothyroidism, and then also it also causes reduce in coronary blood flow. Okay, which is not good. Okay, we don't want to see a reduction in coronary blood flow, and that's something that might happen if you give patients a cholinergic agonist, or if they were given a cholinergic agonist, or they were forced to be given a cholinergic agonist. So these are some of the effects that you might see. So thyroid gland, okay. So hypothyroidism, and then also reduction of coronary blood flow. So we'll continue in the next video.